The last challenge is clearly procurement and adoption of devices. The best word that people came up to describe this, and it was described not once but probably 318 times, was, Anne, it's ugly. We need to fix the ugly in the procurement process. And one of the things driving procurement, to be honest, is the financial models that drive healthcare systems. Right now we are in, and we will continue in Canada and many other countries to be in a publicly funded system. There is only so much tax dollars that's going to be available to fund healthcare. In Ontario right now, it's 46 cents on the dollar. If nothing changes in our healthcare system by 2020, it will be 76 cents on the dollar. Those additional cents on the dollar can only come from a few other big sectors. Guess what one of them is? Education. And that would be universities. So it's an interesting and it's a very, very challenging environment. If you have limited funds to spend on healthcare, and if we insist on continuing to deliver healthcare systems in very antiquated environments that were established in the 50s and 60s that aren't meeting the demands of our patients coming to us, then your only option as a procurement strategy is to focus on give me the cheapest, 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 cheapest. So cost seems to be the ultimate focus of our procurement strategies for developing or for adopting new devices. And what that means is the big companies maybe survive a little bit. The smaller companies can't possibly compete at the same level. And absolutely very limited evidence suggests that when we're looking, those procurement processes seem to be focusing exclusively on cost and not on long-term impact. So if there's a device that costs $50 more than the other three that I'm looking at in this procurement process, and nobody's looking at, but wait a second, that $50 is accomplished or recovered about 6 times over because it's so much more effective at streamlining and giving these physicians and health practitioners the information they need to keep people independent in their homes, particularly our elderly population who are growing and don't want to be, quite frankly, in emergency rooms and long-term care facilities, then the procurement process has to change. One of the things procurement has done in Canada, for those of you who may or may not be aware, is the group purchasing organization concept. So in order to get a better cost, let's have 54 hospitals join a group, and we negotiate not one hospital to with the device company. We're bringing the power of the size of a much larger market with those 82 hospitals, and we can drive the price down because you're going to be able to sell more, and we'll both try to survive. One of the negative outcomes of that procurement strategy is this monopoly feeling. Monopolies tend not to create the best opportunities for innovation, and the last thing they do is support the innovation adoption of devices that really could change clinical practice and healthcare system service delivery in a substantive way by keeping people out of hospitals, keeping them well cared for, and monitoring and managed remotely in their communities. But if we don't invest in those devices to allow health practitioners to do that because of our procurement hurdles, then we're not going to have a thriving device industry, but more importantly, we are not going to have a healthcare system that can possibly meet the demands when it's going to cost the province, just this province, 76 cents on the dollar. So that procurement system is extremely important, and the word ugly needs to change to manageable, and then down the road, maybe not bad, and then we'll seek optimal when we become the global leaders. And I say that looking at my colleagues at this table and hope they'll help us get there.